Near-death experiences, or NDEs as they're known, have been recorded from the earliest historical times. And effectively what it is when somebody is close to death. Now, by close to death, I mean that they could be in an accident, they could be having a cardiac arrest, they could be drowning, and in many cases people falling from great heights and surviving. Around about 20% of the population report a sensation that is quite unusual, what we call an altered state of consciousness. And what they first feel is that they are floating outside of their body, they're viewing their body from another place, another location. They also feel that they see a bright light, the white light that we hear lots about, and they feel they're drawn towards this white light. When they get into the white light, they also feel that they interface with other entities, other beings. Now, some of these beings sometimes are people who have already died. You know, they'll be a grandparent or a friend who's died. They also reportedly encounter something called a being of light. Now, the being of light is very intriguing because the being of light normally symbolises something. It'll either be a religious figure, it'll be a historical character, or it will be a person that has had great emotional attachment to the dying person. I'm a member of the International Association of Near-Death Studies and the Scientific and Medical Network, which are a group of professionals who are interested in phenomena such as these. But the general population of physicians tend to be rather dismissive. And it's purely and simply because it doesn't necessarily fit in with the present scientific paradigm. You know, effectively the idea of somebody floating above their body just doesn't fit in with modern understanding of how the brain works. The problem is when they are reported, or when they're reported by people who have these experiences, it's very difficult for you. Imagine you're somebody in a hospital. You have had this most amazing experience and you come to, and you're trying to explain it to a doctor or a nurse or something, and they think you might be crazy, because effectively that's the main worry that people have, is they have these extremely deep and meaningful experiences and suddenly they're back in reality again. And you can imagine you turn around and say, well, I felt I went to heaven and I saw heavenly creatures and I felt I was outside of my body. You're going to be thinking the first thing they're going to be doing is calling for the psychiatrist and referring you to a psychiatrist. And indeed, that's what happens a lot. So what we need to do is to be able to sort of nurture people, to make them feel at ease, to talk about these things in a non-judgmental way, which is, I think, is one of the things we're trying to do at the moment with this book. I think the first thing to do is to show understanding, you know, to appreciate that this person has gone through an extraordinary experience. It may be a personal experience, it may be hallucination, it may be many, many things. But it's important that the person feels at ease to give their story in the way they want to tell it. So what you need to do is to ask the person to narrate it in their own words, describe exactly the sensations they felt. Because effectively a lot of these things with time may fade as well. So it's very important that the person reports it as soon as it takes place. You then allow the person to flow with their own narrative. Take into account the things they describe. And in terms of actually using your own skills, in terms of your medical skills and your medical knowledge, to probably bring in your own personal opinions about it in due course, but not initially. What we need to also do is if there's any kind of information, and this is profoundly important, is one of the major areas of NDE research is the veridical proof. The idea that if somebody claims they've had an out-of-the-body experience and they have viewed, say, something happening in the operating theatre while they were under anaesthetic, if they claim that they saw certain things, please try and check as quickly as possible as whether the circumstances in the operating theatre was as they described. Say, for instance, they saw particular equipment being used or particular discussions that took place when they were supposedly in deep anaesthesia. These are the kind of information we need, because it's very much veridical proof that somebody could have possibly been outside of their body under those circumstances. And the only way we're going to know about this is by having the proof available to us very quickly. You know, I've been involved in the study of this particular subject now for probably about 15 years. And I have noticed more and more academics getting involved in it, more articles in academic journals about it. Even though the articles may be dismissive in many ways, I think that generally the public are interested in this phenomenon anyway. And I think that probably there is a general sea change in terms of society. People are tending now to look at the softer aspects of what it is to be human. I think we've gone through a period of very, very extreme rationality. And we're now finding, with the evidence we're finding from quantum physics and other areas of research, that the way we see the world is breaking down slightly. And I think we're as much interested in the inner psychology as and our interface with the external world. There have been a few very, very high-profile research projects done. I mean, at Southampton Hospital, I know that people like Sam Parnia have been working on this kind of thing, and it's been reported a lot in the press. Now, what we're hoping is that as people become more aware of these things, more people will come forward with their experiences. Because, again, as I was intimating earlier, I guarantee there's an awful lot of people out there who've had near-death experiences, but don't actually know that's what it was. Our hope is that this book will end up in libraries, university libraries, college libraries, that kind of thing, even ideally as part of the reading material for particular courses in universities and colleges, simply because it is just another tool by which clinicians can understand their patients and what their patients are going through. We'd also be then in a position that the people out there who are interfacing with patients on a regular basis will have some kind of structure and framework by which they can hang the experiences upon. There are very many important contributions in the book. There are different chapters written by different experts, so the phenomenon has different angles, and it will help people to place that in certain criteria, in certain specific areas, and this is important. We also feel that it's just giving people an understanding and appreciation of exactly what the phenomenon is as well, which is important.